Minister, as the public safety minister, are you aware of the diversion of so-called safe supply drugs to the black market in BC?
Mr. Rao, there are issues that are happening in BC, and a lot of it falls under the jurisdiction of the province, Mr. Rao.
Do you know the magnitude of the problem? Do you know how much money flowed into the hands of the criminals?
Mr. Rao, the issues around illegal drugs.
I'm sorry
fentanyl,
to interrupt, but time is up.
Minister, I want to continue with my question. So do you know the magnitude of the problem that the safer supply drugs are being resold to the criminals?
Mr. Rao, I recognize the deep impact of drugs, illegal drugs, including what you're suggesting, which is selling of safe supply, has on communities. It is abhorrent. I've had the chance to meet with many law enforcement, even including
no, again,
in British
Minister,
Columbia.
I'm sorry to interrupt, but do you know the magnitude? So how many pills were being get into the hands of the criminals? How much money flowed into the hands of the criminals? Do you know that?
Mr. Rao, with respect to British Columbia, I do not know that.
Okay. Now, again, do you know that the police chief of London, Mr. Tai Tran, said that the safer supply program are fueling the illegal drug trade? Are you aware of that?
I've had the opportunity to meet with the police services in London. The chief, when I visited there, was not in London, so I wasn't able to meet with him, but I met with his deputies as well as a number of his superintendents. We talked about some of the challenges that they face in their downtown, including
again,
on issues
Minister,
around safe
you know,
supply.
because of the time, I have to interrupt. So clearly, you do not have the information. So is it not your obligation to be informed?
Mr. Rao, I am well aware of the challenges that are faced by our main streets, many of our municipalities. I've been working with the fentanyl czar. Even yesterday, I met with the fentanyl czar and several organizations relating to mental health. I have visited many of the downtowns of incidences that you're talking about, and I deeply understand the challenges that we face. It is a culmination of issues that congregate
Okay,
into...
again, sorry for the interruption. Now, this is an article in a medical journal, JAMA. And in this article, it reported that the safer supply program was associated with increased opioid-related hospitalizations, expanded illegal supply, and increased demand of illicit drugs. So are you aware of this report?
I did not personally read that report, no, I did not.
So you are not on top of the issue. So how could...
Mr. Rao, you're showing me a piece of paper. It doesn't, you don't even cite what the article is. You don't cite who the author is. You don't cite who the researcher is. You don't cite with which institution is attached to it, and you're asking me to comment on it.
So is this not your obligation?
Okay, I'm sorry, Mr. MPL. This is becoming difficult to understand and to follow. You have another 2 minutes and a half.
So is it not your obligation and your responsibility to be informed and be on top of the issues so that Canadians will not suffer from the illegal supply of drugs on the streets?
Mr. Rao, I invite you to go through my itinerary over the last 4.5 months. Every major city, every mid-sized municipality I've visited, I have visited the downtowns. I have visited many of the areas where there are challenges, including on drug use, on fentanyl use, on meth use, and I wholly understand the challenges. Let's not...
No,
let's not question each other's...
Political problem.
Mr. Rao,
Sorry.
If I may,
Mr. Minister and MPL, both of you are overlapping, and I understand we want to have a free flow of conversation, but sometimes it becomes impossible to understand and to interpret. So I would ask both of you to make sure we understand.
Yeah, I'm particularly talking about the safer supply program. It's because of exemption given by your government that these drugs are being flowed into the hands of criminals. More people die of overdose. More young people are being, get into drugs. And the money that flow into the hands of criminals are making the problems even worse. And the Canadians are feeling that they are not being safe in their community. So how could you not take responsibility?
Mr. Rao, you're talking about a program that is run by the provinces. Safe Supply is not that's run by the federal government or authorized by the federal government. It is at the request of the provinces that these programs run. I will take responsibility for a lot of things, Mr. Rao, but I'm not taking responsibility for something that the province is responsible for. What I do want to talk about, if I may, is...
So again, sorry to interrupt, I would pass on the time to my colleague, Mr. Gill.
Unfortunately, there are only 10 seconds left, MP Gill, so I doubt that there will be an answer.
Well, I'll make it very straightforward question here. Do you know the leading cause of death for children in BC?
Look, I think there are a lot of things happening, but I know fentanyl is amongst the top.
Yes, so
top
I'm sorry to interrupt, but that's all the time we got.